All right, let's talk about something that pretty much everyone deals with, but maybe doesn't really understand: anxiety. We're going to get under the hood, see what makes it tick, how it works, and this is the important part, we're going to walk through a real, practical toolkit you can use to manage it. So let's dive right in.
Have you ever had that feeling? You know, the one where your worries are just running the show? The racing thoughts, that heart-pounding feeling, like worries just grab the steering wheel and you're just along for the ride? It can feel super isolating, I get it. But here's the thing, it's one of the most universal feelings out there. You are so not alone in this.
Okay, first things first, we have to draw a really important line in the sand. See, there's a huge difference between just feeling anxious, which, is a totally normal part of being human, and actually having an anxiety disorder. Nailing this down is the foundation for everything else we're going to talk about.
So, what is anxiety, really? Well, at its core, it's just an emotion, a feeling. I want you to think of it like this. It's your mind's built-in smoke alarm. Its whole job is to go off when it senses potential danger in the future so you can get ready for it. It's a survival tool, honestly. And when it's working right, it's actually super useful.
So the big question is, when does that smoke alarm go from being a helpful friend to, well, a faulty one that just won't shut up? See, normal anxiety is temporary. It's tied to something specific, right? Like you've got a big presentation coming up. But an anxiety disorder, that's a whole different ballgame. It's way more intense, it can stick around for months, and it starts messing with your day-to-day life, a lot of the time without any obvious reason. It's basically the alarm blaring when there's no fire. Heck, there might not even be any smoke.
Okay, so what's keeping that faulty alarm ringing and ringing, even when there's no danger? Well, for a lot of us, it comes down to a set of mental habits. These are specific ways of thinking that kind of create this non-stop feedback loop of worry and fear. So let's pop the hood and take a look at the engine that can really send anxiety into overdrive.
These things are called cognitive distortions. And let me be really clear about this. They are not a sign that you're weak or broken. Not at all. They're just mental shortcuts. Your brain is trying to be efficient and save energy. The only problem is, sometimes those shortcuts lead you down a really dark, bumpy road.
Here's a classic. You'll probably recognize this one. It's called catastrophizing. This is where you take one potentially bad thing, and your brain just blows it up into this absolute world-ending disaster. Like that one presentation you're nervous about, suddenly in your mind, it's the single thing that will make or break your entire career. Sound familiar?
Next up, we've got the trap of extremes. This is black and white thinking. With this one, there is no middle ground, no shades of gray. In your mind, you're either a complete, total success or you're an absolute failure. There's no room for good enough or, hey, I gave it my best shot.
Then there's, oh boy, one I think a lot of us are guilty of: mind reading. This is when you are 100% convinced you know exactly what someone else is thinking. And, surprise, surprise, it's almost always something negative about you. All of this, by the way, with absolutely zero real evidence.
And how about this one? Overgeneralization. This is where one little negative thing happens, and your brain decides it's a permanent rule for how life works. So a coworker walks past you in the hall and doesn't say hi. A simple thing, right? They were probably just busy. But your brain turns it into this huge, never-ending pattern. They must be mad at me. Nobody here likes me. I'm always going to be the outsider.
But here's the absolute game changer. The most powerful thing to remember. You do not have to believe every stupid thought that pops into your head. Just learning to spot these patterns as they're happening, to be able to say, there's that catastrophizing thing again. That alone starts to take away their power. That little bit of awareness, that is your first big step to getting free.
Okay, so we've talked a lot about the mind, but anxiety isn't just in your head, is it? Nope, it lives in your body too. So now that we've looked at the mental engine, let's switch gears and talk about a super powerful physical tool you can use right now to calm your whole system down. Think about what happens when you get anxious. Your breathing gets all fast and shallow, right? Well, that means less oxygen is getting to your brain, and your brain does not like that. So it starts sending out panic signals, you get dizzy, your heart starts racing, and guess what? Those physical feelings just make you more anxious. It's this awful, vicious cycle. But the good news is you can break it.
The technique is called box breathing, and it's incredibly simple but so powerful. You know what? Let's just try one cycle together right now. Just go with me. Ready? Gently breathe in through your nose. 2, 3, 4. Now just hold it right there. 2, 3, 4. And slowly exhale out through your mouth. 2, 3, 4. And hold again at the bottom. 2, 3, 4. That's it. That's one cycle. Seriously, doing that for just a minute or two can totally reset your nervous system. It's like a reset button you always have with you.
Look, tools like box breathing are amazing for calming things down in the moment. They're fantastic. But for real, long-term, lasting change, nothing beats getting professional support. So let's talk about what the gold standard for treatment actually looks like.
One of the absolute heavy hitters in treatment is something called cognitive behavioral therapy, or CBT. And there's a reason it's considered a gold standard. It goes right after that anxiety engine we were talking about earlier, those cognitive distortions. CBT basically teaches you how to become a detective of your own thoughts. First, you learn to spot those distorted thoughts as they happen. Then, you learn how to actively challenge them and reframe them into something more realistic. It's like taking your brain to the gym, and man, does it work. We're talking a 75 to 85% effectiveness rate.
So if you're thinking about finding help, what should you look for? What are the green flags? Well, first, they need to have the right education and credentials. They should be using methods that are actually backed by science, like CBT. You need to feel like you can trust them, that they get you. And of course, confidentiality is 100% non-negotiable. And if you can, find someone who has experience with the exact thing you're dealing with.
And just as important, let's talk about the red flags, the things that should make you run the other way. If they don't have a professional license or proper education, that's a big one. If they're pushing weird, unscientific methods on you, nope. And any therapist who's judgmental or violates your confidentiality or just makes you feel off, those are all huge signs to find someone else. Seriously, trust your gut on this. If it doesn't feel right, it probably isn't.
Now, I want you to just let this number sink in for a second. 85 to 90%. That is the success rate for treating anxiety disorders when you combine good therapy, like CBT, with medication when it's needed. That isn't just a number on a slide. That is a massive, flashing sign of hope. It tells us, without a doubt, that treatment works.
So, what's the big takeaway from all of this? It's actually a message of incredible hope. Anxiety is very, very treatable. It does not have to be a life sentence. It just doesn't. With the right help and the right tools, getting better isn't just some far-off dream. It's the most likely outcome.
So let's end with a question for you, a little homework, if you will. Based on everything we've just talked about, what's just one of those automatic, anxious thoughts that you can start to question today? You don't have to fix everything overnight. Just start with one thought and ask yourself, is this thought really 100% true? That simple question, that's where you start taking back the driver's seat.